Dr. Marisa Richmond, who teaches at MTSU and is well known in the community as one of our, I think, most effective trans advocates. And she, I believe, is still the only trans member of the Democratic National Committee.
I just became the only one.
So, yep, unless we have a second, you're it. And has done just tremendous work across the region advocating for trans individuals and trans rights. And so she's just going to talk to us about community partnerships. And with that, I'll turn it over to you, Marisa. Thank you for being here.
Thank you, and thank you all for being here. Yeah, I was in October. I was just named to the Democratic National Committee.
That's a round of applause.
And there were previously two, but they're no longer there. So I'm the only trans person for the whole country. And in fact, Thursday morning I fly up to D.C. for my first official meeting. So we've got a pretty full agenda, which includes Friday afternoon, the LGBT caucus. So I'm getting emails and phone calls, and we'll finally all be together in D.C. Next week. So a week from today, that's where I will be. So I appreciate the opportunity to be here. I've been involved in the trans community in Nashville. I'm a native of Nashville, I should say. I did move away for many years to go to school and work, and then I decided to move back in 1992. And I started, one of three people who started the transgender support group here at the Tennessee Vows. And then I've been involved first at the local level and then with state and national organizations. I joined my first national organization, what was the American Education Gender Information Service, or AEGIS, which was an Atlanta-based group, and I was the board chair for 3 years from 1996 to 1999. Most recently at the national level, I was on the board of the National Center for Transgender Equality. We just had our executive director here in Nashville just a week ago for a fundraiser. And then, of course, at the state level, in 2003, we started the Tennessee Transgender Political Coalition. There were 4 of us from parts of the state that came together. The spark for that was a non-discrimination ordinance that had been introduced here in Nashville that left transgender people out. And one of the things that we were saying around the country in the 90s and early aughts was that all legislation, all policies must be fully inclusive. You can't talk about equal rights for all when you're leaving people behind. Equality means everybody. It doesn't mean some. And so we formed our own organization, TTPAC. We've been around since May of 2003, so we're about to turn 15 years old. So I thought, since we were talking about community partnerships, I'd just start by showing you some of the many groups that we have worked with, specifically on state legislation. We've worked with other national groups like GLMEA and HRC and others. But specifically on Tennessee-based legislation, we tend to focus on Tennessee groups. And there's a very simple reason for that. Our state legislature is very, very xenophobic. And if you come from D.C. or New York or L.A., they don't want to hear from you. In fact, one time on what I thought was a relatively innocuous topic, a legislator brought in someone from a national organization in Washington, and she started by saying Tennessee has a lot of catching up to do. You all are one of the lowest ranked states. And they just cut her off, screamed at her, and kicked her out of the room. And she went out running out crying, and all the rest of us went, whoa, you know, we better not do that. So we focus on building coalitions with Tennessee-based groups. And so since we're here talking about healthcare, I thought I'd start by showing you just a handful of the groups. And you'll notice Lipscomb University. You might not think of that as a group willing to partner with the LGBT community, and we certainly do have our share of issues with Lipscomb. However, when the counseling discrimination bill went through, they stepped up and opposed that bill. For those of you who weren't paying attention, the legislature passed, it's now a law, it actually passed and was signed by the governor, that allowed mental health counselors to cite their religion to deny coverage to LGBT people. Now, some people said, well, don't we want them not to do that? Well, the fact is that all of these organizations, social workers, psychologists, psychiatrists, the American Counseling Association specifically, who decided to boycott the state because of this, they all have non-discrimination policies. And for those of you who may be in mental health services, the fact is that If you're not willing to take on patients, then you shouldn't be in the profession to begin with, and we don't want you there. And that's what each and every one of those organizations has said. And the state of Tennessee says, we don't care about your professional criteria. We just want you to abide by our rules in the state of Tennessee. And so they said, basically, screw you to all those organizations. And so their Tennessee affiliates, along with Lipscomb, which has a mental health program there, they stepped forward and worked with us on that. We worked also together with all of these various groups and many others on the Insured Tennessee program to expand Medicaid. For many transgender people, healthcare, mental health or physical health is a huge problem, largely because of economic discrimination. Many people, because they were bullied and harassed in school, don't get much education. Then they enter the workforce. If they do get a job, it's usually sort of lower wage, bottom of the totem pole position that doesn't offer any health care insurance. We supported the American Affordable Care Act because it put in a non-discrimination language that you can't, or specifically for pre-existing conditions. And being transgender is considered, or was, at least prior to ACA, a pre-existing condition. And so we supported that federal legislation, and then we supported this efforts in the state of Tennessee to expand Medicaid under the Affordable Care Act. Sadly, that legislation has yet to pass, but we had a broad coalition of groups led by the Tennessee Justice Center and the Tennessee Healthcare Campaign, and we were part of that to make sure that that messaging and that campaign strategy was transgender and inclusive, and we were glad to partner with that. Of course, another issue that has come up in Tennessee, as with elsewhere, are these crazy-ass bathroom bills. And that's the only way I can think to describe them. We first had one in 2010, then we've had them now 3 years in a row in 2016, 2017, and now 2018. So far, they have yet to pass. The first committee hearing ever held was on the 2016 version. Going back to the 2010 version, that was comprehensive. That any bathroom in any public facility, you had to only use it based on your original birth certificate. I'm curious, how many are carrying their birth certificate with you right now? Okay, so if you went to a movie theater, a restaurant, the airport, those are public restrooms. So you would not be able to use those restrooms unless you could produce that birth certificate. Imagine coming off of a long-distance flight, you've been holding it in because you don't want to have to cram yourself into those little tiny lavatories on the plane, and you get to the airport in Memphis or Nashville, and there's somebody says, can I see your birth certificate? And you say, yeah, I don't have one. Well, then they don't know where to let you go. So you can't go. And I testified, again, the 2016 bill, because this was now targeted at students. And since then, they decided to make it comprehensive was just unworkable. It's like, really? So now they focus on students. Well, my office at NTSU is directly across the hall from the bathrooms. So if that had passed, thankfully it didn't, what I'd said is, if this passes, I would have to stop doing all those extraneous things that professors do, like grading papers and writing lectures and talking to students or colleagues, And I'd have to spend my time in the doorway watching the bathrooms to make sure that if somebody wanted to use one, I'd have to then step in front of them and demand their birth certificate. And, of course, MTSU, we're Division I football. We actually won our bowl game. And I'm 5'5", so I'm supposed to stop a student, a football player, who's like, I gotta go. It's like, well, can I see your birth certificate first? It's like, how well is that going to work? We all know. And I like to quote the Constitution. I know in medical school it's probably not as big of a deal as it is for us in history, but the Fourth Amendment protects everybody from unreasonable searches and seizures. The 14th Amendment says equal protection of the laws. So first, if I stop only people I think are suspect, that violates the 14th of equal protection. But even if I stop everybody, it's like, I have to see your birth certificate just so you can go pee? I think that violates the Fourth Amendment against unreasonable searches and seizures. So I said all that, and then I sat down, and the bill sponsor got back up and said, oh, there'll be no enforcement. Which raises the question, why the hell are you bringing up the bill in the first place? And we had a broad coalition of groups stand with us, including the Tennessee Board of Regents. Their lobbyists, when we talked to them, probably had never thought about this sort of thing before, but they said, well, if they really are all that stuck up on this, then we're just going to make every single bathroom on every campus and every building gender neutral. I said, you don't have to wait. Go ahead and do it now. But you see, a lot of these groups are not even LGBT groups. Tennessee Chamber of Commerce, because we had started to see as that bill moved forward, what was happening in North Carolina. They had passed their bill, and what happened? People bailed out on North Carolina. Millions, maybe even billions of dollars of financial impact. And as those numbers in North Carolina added up, we started to add up numbers, and we got a fiscal note, and every bill in Tennessee has a fiscal note, cost the taxpayers. We got a fiscal note to $2 billion just for the state of Tennessee. And we think that number may have been conservative, that number could have risen much, much higher. That's through loss of Title IX money from the federal government, a loss of tourism, tax dollars, again, from various boycotts, organized or even individual. We had the Tennessee Coalition to End Domestic and Sexual Violence because we saw this as aiding and abetting bullying and harassment and physical violence against transgender people. The Tennessee Commission for Children and Youth decided to join us and come out against the bill. The Tennessee Disability Coalition. I mean, if able-bodied people aren't carrying birth certificates, what is a person in a wheelchair going to do? Chances are their difficulties are going to be even greater. And they're already facing enough barriers and harassment as a result, and we were proud to stand with the Disability Coalition and to have them stand with us. TEA, Tennessee Education. I teach at the college level, but I pointed out high school teachers and middle school teachers would also be forced to do this. And they said, we got better things to do than deal with that sort of paperwork. That would just be an administrative nightmare that none of them wanted to deal with. McGavick High School right here in Nashville has over 3,000 students. And there's no way any of the teachers there are going to know every single student in that school. I think it's White Station in Shelby County, Memphis, also is in the 3,000 student range. And there are other major large schools, and not to mention the junior colleges and all across the state. And there's just no practical way you could enforce this. The Tennessee Immigrant and Refugee Rights Coalition, they stood with us because we stand with them. They recognize if an American, I was born right here in Nashville, if I don't carry my birth certificate, imagine what an immigrant is carrying. Maybe they have a passport, but it didn't say passport. But maybe they're undocumented, so that means no immigrant is ever going to be allowed to use a public restroom on any school in the state if that were to pass. And so we stood with them. And then, of course, as you see, the Tennessee Suicide Prevention Network. Already, we have in the transgender community some of the highest rates of suicide of any groups in the country. In some cases, in some of our states, including Tennessee, suicide rates can be 50 times higher than the public at large. And we believe that those numbers would certainly have gone up if people were being harassed and bullied under this law if it were to pass. And we called it a bathroom harassment bill because that's what it would promote, that's what it would encourage. Some of the other groups that we've worked with, you see here on various other issues, education and all. You'll notice the Metro Nashville Police Department. They stood with us when Vanderbilt was the topic. Vanderbilt University, and I should say Vanderbilt, at least before the split with the medical center, we worked with the deans here about 10 years ago on the non-discrimination policy. And I remember when we were working with the deans on that policy to make it transgender inclusive, the dean said, oh, don't worry, we will be the first school in Tennessee. And a few weeks after that, UT Knoxville announced their policy, and then the Tennessee Board of Regents. And of course, I don't have to tell you how much love there is between UT and Vandy. So when I wrote back to the dean, your big rival just beat you. So, so Vanderbilt fell in line at that point. We were glad to do that. But the police department became part of the battle when Vanderbilt adopted an all-comers policy for student groups and clubs that said that if you discriminate against LGBT people, you cannot operate on campus, you cannot use campus facilities. We never asked for that. That was something that the school on its own decided to do. And so the legislature decided to step in and basically tell Vanderbilt that if you are going to do this, then we're going to decertify your security, your Vanderbilt police. And the Metro Police stepped in and said, don't do this because we don't want to have the responsibility of taking over not just the main campus, but the facility over at 100 Oaks. And that would raise stress on the police department and of course the cost of taxpayers. While their particular issue with regard to the state bill had not anything specific to do with the LGBT community, we appreciated their willingness to step up and speak out against that bill. And thankfully it never became law, mainly because the governor felt that it was inappropriate for the state to legislate against a private organization like Vanderbilt. But it put the trans community and the Metro Police Department on the same side, and we were glad that they were willing to speak up against that bill and stop it from becoming law. I will mention, I'm also on the Metro Human Relations Commission now. I'm serving a 3-year term, and I'm finishing my 2nd year now. I'm up for renewal next year, although I don't know what mayor will make that decision. But we do trainings twice a year with the police department, and they're not perfect. We know they're not perfect, but we're making progress 1 year at a time, one police academy class at a time, to raise awareness of LGBT issues, and specifically with relation to the transgender community. There have been a few interesting studies that have been done with regard to the trans community and healthcare. One of the first, dating back to 2011, is the National Transgender Discrimination Survey. We had about 6,400 respondents from around the country, and of those 6,400, 400 genders were identified. One of the things that we did on this study that's unique is that it was not a checkbox for gender. It was a fill in the blank. And we let people define their own gender. So 6,400 people produced 400 different genders. But that's a national study, and there is a Tennessee report under that particular study. We had about 73 to 75 people in Tennessee participate. The numbers were really eye-opening. Specifically with regard to healthcare, many people reported that they had been bullied and harassed by healthcare providers. Many people refuse to seek out healthcare because they're trying to avoid that bullying and harassment. Some people, of course, can't afford it. Again, getting back to the economic issues and insurance-based discrimination, which we've been trying to address, particularly since 2011. There's a follow-up study that was published in 2015, the U.S. Trans Survey. This time we got the national numbers over 20,000 and about 400 plus from the state of Tennessee alone. And while, again, the numbers from the two surveys are relatively similar, the fact that we were able to expand the number of participants helped us close a few loopholes, especially because in the first survey, we forgot to ask people where the discrimination occurred. The second survey, we did ask those questions, so we were able to get more accurate data for specific locations. And again, with more people participating in that study, both in the state of Tennessee and nationally, it helps us understand what was happening, what it was and is happening. And then the other three you see, including one that was just published on Monday. This is literally brand new. Transgender men's HIV and PrEP needs are not being met. These other three studies look specifically at those sorts of issues. I just gave a talk to I mentioned the Metro Public Health Department on Tuesday, and so I had just read that report the night before I went in and talked. And what it says, of course, is that trans women, we tend to dominate a lot of the studies, a lot of the discussions of transgender issues, and trans men are often overlooked, and we're trying not to allow that to continue. We want to elevate all of the issues, all of the concerns. At least those two national studies do help bring out many of those stories, many of those issues, that then allows us to work, again, with other coalition partners at the local, state, and federal level to advance programs and better care for everybody. Any questions on that? I don't want to just sort of rush through anything. Of course, many of you probably are familiar with TransBuddy here at Vanderbilt, an excellent program that as I was explaining to the Metro government, a lot of people, again, are afraid and intimidated by medical care. There is a lot of fear and trepidation. And so the creation of TransBuddy has been a really valuable resource, and some of you may be volunteering. If you're not, I encourage you to reach out to TransBuddy and to offer your services. It's available to people 24 hours a day to sort of hold their hands and help them walk through the process so that they're not going through alone. And while Vanderbilt overall is very friendly and open, there's still some people, sadly, my generation, I'm up there in age, I have to admit, who are maybe not as open, not as welcoming. And so TransBuddy is there to help walk people through this program. It's been nationally recognized. There was an excellent story about the group in USA Today, and it's starting to become a model. We're looking to recreate it in other cities and states around the country. I even had a discussion with folks over at St. Thomas Hospital, a Catholic hospital. And although the trans community has had some issues with the Catholic Church, the fact is that the people there at St. Thomas are trying to open their doors and be more accessible and to create more opportunities. I will mention, of course, that a few years ago, HHS said that any medical person, medical care provider, hospital that receives Medicare money can't discriminate against any LGBT person. However, that policy was reversed about 6 weeks ago by the current administration, and saying that they most certainly can discriminate. Now, we're hoping that hospitals, care providers around the country won't go back in time. But at least for the time being, we have this new interpretation of federal law, because Medicare, Medicaid Act, along with the Civil Rights Act of '64, which covers employment, the Open Housing Act of 1968, just 50 years ago this year, Title IX for Equal Opportunity and Education Act, all of them have sex discrimination language, and we've seen gains under all of those for workplace, education, housing. There is an attempt to reverse the interpretations of that, although by the administration, although the courts are still standing with us, at least for the time being. But we want to make sure, as we work with care providers, that just because this current administration says those rules don't apply to trans people, it doesn't mean that they have to close their doors now. People can continue to take Medicare money and be open and accessible. We hope people will continue to do that. The Federal Employee Health Benefit Plan, which is the largest health care system in the world, or at least in the country, I should say, at least has been up until now trans-inclusive. We don't know if the administration will try to reverse that as well. We hope they don't. Many people who've served in the federal government, especially the military, have been covered. The VA around the corner is also open to trans people, although I joked when they adopted the policy that just means trans people can stand in line with everybody else now. And so, we've worked hard to get those policies changed and updated. We're going to continue fighting for the time being to maintain those policies. Whatever we may lose, when things turn around in Washington, we'll be back and pushing to reestablish those and solidify them through law. But we continue to work with care providers, with medical schools here in Tennessee and around the country, and to do whatever we can to ensure those resources are available to people. And then, of course, the other group you see there, the Tennessee Vows, that's I mentioned that at the beginning. That's the transgender support group. It's mainly an adult group. There is a youth group, and I didn't put them on there. I don't think they even have a website. It's called Trans Youth Meet to Empower, or TIME. But they meet in conjunction with the PFLAG chapter of Nashville. So the parents are in one room, and then the kids go into another room, and they scream and yell and throw things around. But it's an opportunity for the trans kids to be themselves and just to, be around others who are like them and share the same concerns or have many of the same issues in their schools. So TIME and PFLAG literally do meet together in the same building at the same time, and it's an opportunity for both the kids and the parents to share information. And I usually sit on the side with the parents, and the most common question is, where do my kids get hormones? What am I expecting? How do I deal with this? I mean, I thought they were mostly going to focus on school issues, but the parents are actually more interested in the medical side of things. What's going to happen to them, and how do I deal with this as those changes start to occur? What can I expect? And so being able to work with PFLAG and through TIME is really providing a very valuable resource for trans youth and their families here in Nashville and Middle Tennessee. Some of those parents will drive an hour or 2 hours to get here, because once you get outside of Nashville, you're a minimum a 2-hour drive to the next closest city with any significant resources. So we're glad to help and facilitate all of these resources, all of these allies and partners to try to improve health care, mental health care, physical health care, and even just getting through school. Some people, even if they're not transgender, bullying and harassment, especially in this cyber age, is a real problem for a lot of people. And we're doing what we can and using whatever resources we have, whether it's local, state, well, forget the state, federal. Although I'll admit, we do have a good relationship with the Tennessee Department of Health and the Tennessee Department of Mental Health. And I'm supposed to speak to TDOH. Well, we're supposed to do it on Wednesday, but it seems they said they double booked, so we're now trying to reschedule. Somebody, I guess, with the right hand didn't know what the left hand was doing. I hope they don't do that in surgery. But in any case, I have spoken to the Department of Health before. We were supposed to do it this Wednesday. We're now working to find a new date. But at least with TDOH, and especially through their HIV surveillance programs over there, they're really open and welcoming and accessible, trying to do what we can to improve access to health care, especially through public health clinics around the state. And so by having a state agency working with us, it allows us to reach out into local communities all across the state from one end to another to improve that access to health care. So that's what I was going to say formally, but we still have plenty of time. I'm more than happy to open it up to any questions you may have. That's not my water.
What are some spaces or organizations or resources that you think that the trans community in Nashville and in Tennessee is lacking?
Well, I've seen some talk about specifically ethnically focused groups, for blacks and Latinos. Memphis is a predominantly black city, so they do have gatherings there in Memphis, but that's the only place where that's being done. There isn't anything that's specific to trans people of color in Nashville or any of the other cities, but Memphis is doing that.
Follow up to that, what is the queer community in Nashville doing wrong by the trans community?
Oh, geez. Well, I mentioned, of course, what happened in 2003 with that non-discrimination ordinance, leaving us out. And, of course, we screamed about it. Sometimes, I get to feel it, sometimes there are still meetings taking place without trans inclusion. Recognition of people or organizations who may be transphobic. There are some people who may be supporting a candidate who supported the bathroom bill. Recognizing a business that still won't put trans people in their non-discrimination policy. that sort of thing, and so that irritates us. 2.5 years ago, TTPAC was one of the co-sponsors of a mayoral candidate forum. It was, we had 7 people running, submitted several questions, and not one of the trans questions was asked. But marriage was asked twice, and another question was asked about who's your gay icon. Didn't say anything about what they would do as mayor on these issues. And so when the trans community blew up, they got mad at us. It's like, our questions weren't asked. This was our forum too. And they acted like we were the ones causing the problem.
Who's that?
The people, a couple of the organizers of that forum. Like, well, you're insulting Chris Conte. It's like, no, we were standing up for ourselves. I even had someone, this is the trans pride flag symbol I'm wearing, and I had someone actually criticize this, saying, well, why do you have to have your own symbol? Like, when you're marginalized, you have to stand up for yourself, to be visible, to be seen and heard. There was a man back in the days of the old Negro Leagues, Ted Ratcliffe, and so there was the Negro Leagues and then there was the organized leagues. And he says, oh, we were organized, we just weren't recognized. And that's how the trans community feels. Yes.
So, like for some of us who are in Memphis, I know there is a central compartment, for the trans community as well. There, can we as well, have affiliations with Trans Buddy, even though we're not in Nashville?
I'm not specifically involved with Trans Buddy, but you should talk to the people who are, and see a way that you can sort of create that. Trans Buddy is specific here to Vanderbilt, but like I said, it can serve as a model for creating something in Memphis or any other city. And so I encourage you to reach out to Trans Buddy and say, can we meet and talk and figure out what you all did and see how we can transfer that? Because they are absolutely willing to work with anybody who wants to copy their model. If you want to pay them royalties, fine. Sure, do it. They only have one paid staff person, by the way. Everybody's a volunteer. I think the majority are cisgender because it's the right thing to do. Yes?
So I'm coming from California. I just moved here, but I know even in California with insurance companies, it is so hard to advocate for yourself and navigate, how to fight for the right to transition and get things covered. Are there specific community resources where you could guide someone that kind of has it narrowed down for Tennessee, like what to do?
Well, there are the ACA navigators. But as far as, making sure that those policies are trans inclusive, not really. Last month in the Human Relations Commission, we had 2 young trans men come to us, both who happen to work for the police department. And the Metro policy, even though Metro Nashville has a non-discrimination policy, their health care plan actually has exclusions in it. And so they said, what can you do so we can get full access to all transition-related health care? So even though we've known that was the case, we had to wait for somebody to come and complain. So now they did. So now we have started that process of looking into this and figuring out how we go about changing that plan. We're not sure if we have to go through the council or the Metro Civil Service Commission. So far, it's just those 2. So I'm hoping that won't bankrupt Metro Nashville. We're about to spend, $5 billion on transit. 2 trans men get surgery. Shouldn't be that bad. But we have to. We're starting that process of looking at all of that and figuring out how to go forward. And so, we're encouraging other people in other communities to look at their local health care plan. For the state of Tennessee, a couple of years ago, the commissioner of insurance was testifying before a state legislative committee, and she was asked by a couple of the committee members about LGBT. Well, they said, those people, you gay people. It didn't mention trans, but they meant us too. We know that. And she says our plan doesn't cover them because they were particularly worried. This was right before the Supreme Court ruled on marriage equality. So they said, well, we have to start covering those spouses. And she says, well, we don't now, and we can't predict what the Supreme Court's going to do. So they were prepared to introduce legislation to stop spousal benefits. Now, that was, that's not even talking about trans people. So they were determined to make sure that even gay and lesbian people couldn't get benefits for their spouses if they worked for the state of Tennessee. So it's really hard in this state. Nashville arguably is the most progressive city. So if we're going to get it anywhere, we're going to have to start right here in Nashville. But we are seeing those plans here. Like at Vanderbilt, it started with the students, not staff or faculty. And it's because a student said, why can't I get this covered? And I was in a meeting with Chancellor Zeppos, and he said, we've got good students with good ideas, and when they have a good idea, I'm going to support it. And he said, it was a good idea, so we said, yeah. So Vanderbilt students are covered. But he says, staff and faculty, well, we got to find the money first. But the students are covered here. And I applaud Vanderbilt for taking the right step. But at University of Memphis, as a state school, the state's not ready to take that step. And the same is true for us at MTSU. And we have talked about that in our faculty meetings. Yes?
Who are some other prominent trans leaders in the Nashville community? Or is it just you?
She's the godmother of the community.
Well, Carrie, did you want to? I'll let you answer that.
Oh,
Because you go everywhere, you see everyone and everything.
well, thanks. Marisa is, I make the joke all the time, and she's the godmother of the trans community. She basically is on
I
point.
give them offers they can't refuse, in other words.
Exactly. The trans community in Nashville, to be very honest with you, is rather small, and I wouldn't say we're not necessarily closeted, but many of us are private because we're living in the South, and it's a private community. Many trans people come from very religious families. I work for the local gay and lesbian newspaper. I'm a columnist with them under a pen name, so I guess I count, but we're growing leaps and bounds, but we have a ways to go. The one thing I can tell you is that while we don't have an official representation, Marisa is our official representation, to be very honest with you, and she's great. But we are growing. Things are getting better for trans people here. We've got a ways to go, but it's better than it used to be 25 years ago. So who's the representative of the community? It's going to be your generation. It's going to be people like you, your age, who are going to be coming out, stepping forward a lot younger than I did, and saying, hey, look, this is me. I'm living my truth. And, if you got any questions, just ask. Medical providers especially will be very good role models for people who are coming out, not only as trans, gay, lesbian, whatever. If you can give a welcoming environment to people who are doing this, especially at younger ages, you're going to see more people step out and say, hey, this is me, I am this, and while it's not all of me, it's a significant part of me. I'm very proud of it. Does that make sense?
When I talk to those kids in Time and their parents in B-Flag, I said, I grew up here. Those things didn't exist. Those resources weren't there. There were no advocates. But there were a lot of us all over the country, not just here. I even got a phone call last night from a friend in New York who has just announced she's running for state legislature, and she's got a damn good chance of winning. She was actually an elector for president in 2016, the first in history. So she has a long years of experience in politics, and she has a realistic chance of winning. And we had 9 winners last year alone. And more of us, like myself, are appointed to various offices. And so we have the opportunity to serve our communities in various capacities. Pennsylvania and Virginia even had 2 cabinet-level commissioners, both over health. And ironically, the exact same last name, Levine. Marisa Levine and Rachel Levine, not related. But those 2 states, those governors appointed transgender cabinet officers. We even have 2 transgender judges in Houston and Alameda County, California. And so, we expect those numbers to continue growing. We've got, believe it or not, a trans person running for the United States Senate in Tennessee this year from Bradley County. I don't think he's going to win. He's running as an independent. But we actually will have a transgender person on the ballot this November in this state. And others are running for more various offices all over the country. And so, and of course, I just went to see a Fantastic Woman on Sunday. She's going to be presenting an Oscar tomorrow night. And that film is up for Best Foreign Language Film itself tomorrow night. And Janet Mock and Laverne Cox and many others are on TV and in the news, and a lot of us, especially in the political arena, are in the news. And so those kids today see role models that I did not see. And they can see what's possible, what they can achieve, and being able to highlight those faces and those stories and the books that they're starting to write, or just going on Facebook if a person wants to find someone. Those resources are there that were not there 20, 30, 50 years ago.
My role models, in all honesty, were butch lesbians back in the 60s, 70s, and 80s. I mean, that's what I knew I was. That's what I wanted to be. We had very few, if any, transgender role models. I would say Kate Bornstein possibly be the one for me, at least for my generation. I grew up in the 80s and the 70s. Basically, it's all brand new. It's brand new for us too. Just from a I don't like using the term mainstream point of view. We're not mainstream, but we're kind of getting there, if that makes any sense. So it's all new. Even trans people are figuring out what this is, where do we fit in, so forth. So it's an exciting time, and basically we've got our machetes out, and we're just wallowing through the jungle just like everybody else, trying to figure out how do we get to where we need to get.
A couple of years ago, I was on a panel at the University of Kentucky, and they put me up with a young high schooler. And so at one point, I can't remember the exact question, but I started talking about some of our community leaders, and this kid goes, I guess I need to learn my own history. Because we're making history, yes.
What are some key resources that you think are important for primary care providers to offer their trans patients?
Well, actually, that question came up on Thursday. For starters, my doctor just retired, so I got to find a new one. He had a non-discrimination policy right there at the door. So that was like one of the first things you saw when you stepped up to the desk. And I think that sends a powerful message, not only to the trans patient, but to everybody else who's there, the staff and other visitors. I tell, another thing I said the other day was, get in the habit of asking the same questions of every patient. And a lot of times, people will look at a trans person and like, what do I call you? Well, you should ask that question of everybody. My dad used his middle name, not his first name. He didn't like his first name. And so he wasn't trans. So we should just get in the habit of asking everybody, what name do you use? What pronouns? So that when that androgynous-looking trans person comes in, it's not, well, what do I say? You've already gotten in the habit of asking that question of every single patient. That way you're treating everybody exactly alike. And people don't mind being asked, what name do you like to use? I mean, because your name may be Robert, but maybe you go by Bobby. Or maybe you go by Roberta. So it's the same thing. What name do you use? And, what pronouns do you prefer? I see one person sitting here with their pronouns on the tag. That's cool.
Thanks.
So, so that would be the way I would start. And it really, because if you start going in, it's like, well, it says here Robert, so I'm going to call you Robert. You've already put that wall between yourself and your patient. They're going to react very negatively to that. And that's not what you want. If you want to take care of them, and they're coming to you because they need you, they want you, they don't want to be insulted. Yes?
So I'm coming from the University of Missouri, Columbia, that don't have a lot of resources like this. Most of our, like, if any, trans advocacy is coming from like student levels, not super organized.
Sure.
Mostly groups that aren't recognized by the
And
university.
in Missouri, it's mostly Kansas City and St. Louis too.
Yeah, and those aren't great either. So, like, what advice or like anything do you have for like working to like establish these kind of things, like especially like for who don't have a ton of resources because we're mostly students.
Sure. Well, there must be some sort of any sort of student group, because here at Vanderbilt there are multiple student groups.
Yeah, we have one trans student group. It's not recognized by the university though, so we're not
really?
funded. We're not an official org. Yeah.
Huh. Well, it's time to try to push that along. Maybe find people in your statewide organizations to help you organize on campus, to help you push the university. Since it is a public university, there are organizations, LGBT groups. I can't remember if there's one specific to the trans community, but PROMO is the statewide advocacy group, and don't ask me what the acronym stands for.
The other thing too is you may want to check and see what's going on with reg requirements from the ACGME, because they have specific requirements about education and other stuff around LGBT students, and so you may be able to look under that and have some leverage with the school, with the university. You may have to go to the medical schools first, because that's where it's going to have the greatest impact, and then try and work down. But that might be a possibility.
Also, take a look at the law school, too. The American Bar Association has some good policies, and lawyers don't mind filing lawsuits. So, yeah, going through those professional organizations.
Professional organizations like social work requires advocacy policies for LGBT students and faculty. And so the university has to be subject to that, because if they didn't, they wouldn't have a social work program. So there are some other professional degree programs that you can check into that can actually be there as advocates with you to leverage my partner was on the National Committee for Accreditation of Social Work Programs, and they didn't have even the Catholic universities, the other place. That's why the Baptist seminaries dropped all their social work programs back when the conservatives took over 30 years ago or so. It was because they had to comply with those non-discrimination and diversity requirements of social work education. So you've got some departments there that are under those that would be advocates with you.
Yeah. And if any of you are at a private school, because this is public in Missouri, but if at a private school, take a look at the policies to assist people with things like name and gender changes on transcripts and degrees. Because as I tell people, you don't want to graduate from a school that won't change your transcripts, won't change your degrees, because that's going to out you when you try to get a job. If you can't change that, if you're stuck with that original name or gender for the entire rest of your life. Vanderbilt changes. Most public schools that I know of change. I went to an undergraduate school. My undergraduate school was private, so when I went online and they changed, and I sent them my check with a cover letter, and they called me one day as I was driving back from Memphis, and they said, "We got your request, and we can handle that. We just want to make sure we do it the way you want, because we don't want to cause you any problems." And I was like, "Oh, that's really sweet." And then the woman said, "But just to let you know, you went to school before we used computers." And I almost ran off the road. I thought my transcripts were stone tablets, But at least they changed it. So.
Yeah, but be prepared. When I had to do my name change, basically because it was a church-run college, I had to produce all sorts of legal documents in order to get them to do it. In my case, we had to reapply for a security clearance for my daytime job, so they got the call from the government, and then they called me and said, "Hey, you're under this name now? Okay." So just be prepared. You may have to jump through some hoops, but it's getting better.
Anything else? Yes.
So I work in the child adolescent unit in the psych hospital here, and I'm just wondering I don't know where I'm new here, but any sorts of programs that go into schools that we can talk to our patients that are trans or in the non-binary?
There might be with Metro, but I'm not aware of it specifically. We have 140 school districts across the state of Tennessee, but only 9 have non-discrimination policies. Metro Nashville is one, but none of the surrounding districts have that. We've been trying to work with parents to take the lead. Parents aren't very good at organizing. And so we have not been able to get any of the surrounding school districts. We came close in Rutherford County. There was an organized campaign, but the timing of it was, they tried to do it right before the elections instead of focusing on the elections. And then the Tea Party won, that took control of the school board, and the effort collapsed. So Nashville, we have our policy since 2008, and we got that, we got 2 policies on the same night, anti-bullying and non-discrimination. So the anti-bullying, that was actually led by the ACLU, but the non-discrimination policy was led by the Teachers Union, MNEA, Metropolitan National Education Association. And so if you want to work with your local school systems, start by contacting the school board or the teachers unions. See what they can do to help you.
Do you have a GLSEN in Nashville?
Yes.
I was going to say, wouldn't that be, is that who would go in and work with?
They do some trainings. TTPAC, we've done trainings. I actually had GLSEN on that list. There they are.
Yeah,
Lesbian,
that's
Straight
okay.
Tennessee chapters. So yeah. So we've done trainings. I did one just at the beginning of the school year up in Trousdale County, which is about an hour drive from here. I also did one a few years ago in Williamson County, just south of Nashville, Franklin and Brentwood. We had to do that one at the Oaks Lodge out near Cold Springs. They didn't even do it at the school board headquarters. Yeah, so it was the counselors specifically reached out. And so if you know a counselor or two in any of these public school systems, as individuals, they're pretty good. And those counselors admitted that they probably could not get anything through the school board, but they are the ones on the ground. And so they were willing to do this and willing to listen and learn. Specifically for schools, GLSEN and NCTE have done a joint model policy that's available online. You can get it through either group's website. And so, we recommend that and distribute that to schools when we can get in. Not everybody is willing to listen. And when I spoke at Trousdale County back in September, I could tell that some people in that room were kind of, really kind of nervous and uncomfortable with the topic. But they said they would, try to do their best. And when I talked to the mother and the child, they seem happy with the situation there right now. And particularly, we've always warned parents in August and September that is the highest risk time for suicides because of bullying, because they've been away from school for a couple of months. They're in a more comfortable, relaxed environment during the summer, and now they're thrown back in with people who are going to be hostile, who are going to be mean, and that leads to depression and leads sometimes, sadly, to suicide. And we've had our share even here in Tennessee. Cheatham County, just to the west, actually had 2 suicides in 1 year. It's one of the smallest school districts in the state. And after the first one, the parents and students went to the school board and asked them to do something. And this was after the first suicide. And they sat there in stony silence. Then they called their lawyer up, and he said their policy was adequate and in compliance and adequate. It was in compliance with federal law, but it was hardly adequate. And a couple weeks later, a second suicide took place. And they still have not changed their policy in Cheatham or Williamson or Rutherford or Wilson or any of the other surrounding counties. 9 out of 140.
And that goes for all types of discrimination, not just...
Specifically to the LGBT community. Most counties, at least, even ban harassment on religion or race, but even sometimes they overlook that, especially if they have like Muslim students. And Nashville has a significant number. So the Metro, again, is pretty aggressive, but in some of the surrounding counties, they're not really pursuing that. And then we just saw yesterday Crossville, an elementary school in Crossville between Nashville and Knoxville. An elementary school, in the gym, they had a Confederate flag and a painting of a lynching. And an elementary school. And so there was this outrage. And they said, oh, but this is heritage. Which sadly is true. And so they got parents' complaints and wouldn't do anything. And only when the parents contacted the media in Nashville and it blew up, only then, last night, they said, oh, okay, we'll paint it over. But it took even the people in Crossville to reach outside of Crossville to get the school to take action, that they didn't understand what those images meant and how hateful that message was. And that's something that should be a no-brainer. And so that's right here in this state, this week.
There have been successful lawsuits about bullying based on LGBT in school systems around the country, resulting in awards of up to $1 billion. So it is one of the things that GLSEN educates about and shares and stuff like that. So
yeah, and ACLU, their office,
will do that as well.
yeah, they filed most of the lawsuits in Tennessee, and their office is right here in Nashville, over near Centennial Park, actually, not too far from here. And so they file a lot of those lawsuits for Tennesseans.
Would you say that the ACLU is maybe the biggest legal advocate?
For Tennessee, yes. There are three, for years, the LGBT lawsuits were dominated by ACLU, Lambda Legal, and the National Center for Lesbian Rights. And so those three have sort of split up most of the cases, and ACLU tends to handle them because they're right here in Nashville. But now we're seeing also the Transgender Law Center in Oakland, the Transgender Legal Defense Education Fund in New York, and the Southern Poverty Law Center in Montgomery, Alabama. So those additional three organizations are now starting to step up and working with people who want to file lawsuits. And we are getting some positive rulings from the courts. But, you know, a lot of families would rather not out themselves and their child. It is emotionally stressful. Even though all of them will not ask you to put up a single penny. But their resources are limited. You know, I talked to years ago an ACLU lawyer said people have this image that we're sitting around waiting for the phone to ring. Just the opposite's true. They get piles and piles of requests, and then they have to decide which ones they can take and which ones they have the best chance of winning. They don't want to go in and lose and set the movement back. So they even have to set priorities in choosing the cases that they take on.
I'm a social worker in Georgia. I'm newly a part of the SOGI committee for the National Association for Social Workers in the state of Georgia. They just started it this year. I know this is kind of difficult to do, but can you maybe pick out a few things that are really important? We're going to be doing education across the state, policy, advocacy. What is important to the trans community right now? But this is, I know it's very vague. But
well, there's so many things, starting with healthcare, access to healthcare, access to full transition-related healthcare, employment. We want to be able to eat, have a roof over our heads. That costs money. As a person comes out of the closet, it's certainly, well, for schools, you know, no bullying harassment. People should be able to go to school without fear, so that they can get an education and achieve their goals, whatever those goals may be. For immigrants, one huge issue is incarceration, although that's true even for non-immigrants. We want to make sure that if a person does get arrested, that their rights are being respected and they won't be thrown into dangerous situations, especially if they're misgendered. Of course, for an immigrant, if they have fled their home country to escape persecution, they arrive here without documentation. If they get picked up, ICE is going to send them right back into those situations, and those are potentially deadly. And we're trying to stop that to save their lives. So, you know, geez, there's so many things. especially with this administration starting to roll them back. We did fight in court to maintain the option of trans people serving in the military. There was an effort to rescind that ban, and at least the court stood with us on that, so that if a trans person does want to serve in the military, they'll be allowed to do so. We just heard that under the Obama administration, we had 165 policy wins. We hope over the next, now it's a little over 2.5 years, we don't want to lose 165 of those policies. We're going to fight to hold on to as many of those as we can, and then when things do turn around, to sort of pick up where we left off, to regain those wins, and again, to pass federal legislation in addition to local and state laws that will solidify those wins so they can't be taken away by executive order in the future. Well, it's 3 o'clock, so one last question, because otherwise we're out of time.
How do you convince someone who is more conservative or more religious, or let's just say Republican and Catholic, let's just put it out there, how do you convince them that trans lives matter?
Well, first off, I'm not good at talking that language. I look for other people to do that, because I didn't come from those backgrounds. But there are people out there who do, and they get it. I tend to quote the Constitution a lot, and you heard me say that earlier. Not everybody wants to hear about the Constitution. They certainly don't like the separation of church and state. Rick Santorum said that idea makes him throw up. But to get as many people from those backgrounds, the LGBT community does have a Catholic group called Dignity. Thank you. I knew it was some Dignity USA. There are the log cabin Republicans, although I'm not sure how effective they are. I actually was in a Facebook exchange the other day, and I was pointing out that, of course, there were some trans people at the CPAC convention the other day. And one of them is a Facebook friend of mine. I've never criticized her because I feel that conservative Republicans have to step up because in places like Tennessee, they're the majority, and they speak the language that I don't. And I've never criticized Caitlyn Jenner either, and a lot of people have. I don't think she's effective, but we need those voices. And she's doing exactly what I've said trans conservative Republicans need to be doing. And at least they're trying. And I applaud them, actually, for doing that. I don't criticize them. And so we need to encourage people from those backgrounds, whether they're trans or cisgender allies, we need those voices in those circles. So that's the best answer I can give you. Well, I appreciate your time. We're out of time, but I think we're headed downstairs for refreshments.
You want to contact Soulforce?
Yes.
It's an excellent thing for addressing fundamentalism and LGBT issues.
They've been to Tennessee several times. They've hit Union University and Jackson, Lipscomb here, and I think it's Lee University in Cleveland they've also been to. But they've hit the more conservative religious groups. And so they've been to Tennessee several times.